same mechanisms going on. And sometimes if that gets triggered, that can cause people to have weight regain, and that's one of the things that we really try to focus on in support groups. How many of you have never been here before? Have never been to support group before? Okay, alrighty. Well, don't hesitate to ask any questions. I usually take notes and then I post everything. It gets posted in 2 places, one on the hospital site and one on the surgeon's website. And Deanne is here to video it, so you should be able to even watch the video of Kathy's talk. And I think I will dim these lights just a hair. Will that be a problem, Deanne? Or is that too dark?
Nope.
That's good? Okay. Alrighty, so I'm going to turn it over to Kathy and let her chat with you. And then we will have any questions afterwards. And I don't know if Laura's going to be down with the vitamins and protein. I hope so, before the end of this. But if she's not, I will run up and I can always run up and help get her.
Hello.
Hi.
I'm Kathi Williams, and I've already been. Step back a little bit.
Trying to get on.
Oh, okay.
We need a big tape X on the floor.
Okay. So we got 30 minutes, and so I want to cover a few things in that 30 minutes time. So basically, what I want to talk to you a little bit about today is the connection between feeding and feeling. So most of you here, have you already had your surgery? How many have already? Oh, wow. Excellent. They're coming out to a support group. All right. How many are still waiting? All right. Awesome. Well, I want to congratulate each of you on your journey to improving your health and your life, and I wish you all the best and happiness.
You all need would it be better if she had a microphone?
Yeah. Oh, you can't hear me? I could talk louder if that helps.
Well, sometimes it doesn't get in on the video as well.
Oh, okay.
She could.
Look, she's following. Let's go this way.
She needs to know which square she can stand in.
If you stand next to the podium,
Stand next to the podium.
then I think everybody can see you, and
Yeah. Now we can see all of you.
I tend to be a walker,
okay. Well,
so when I start walking.
I'll follow you.
Alrighty. Wire yourself up there, dear.
Alrighty, let's just put that
Put
right
that in
here.
your pocket.
Can you hear me now?
Now could you whisper?
My God, I just can't believe this group. Okay, so what we want to cover, we want to talk about the connection between what we eat and our feelings. And I also want to talk a bit about eating disorders, particularly those associated with obesity and bariatric surgery. Okay, so the first thing that I want to do is a little exercise. I know you don't know me very well. I am a marriage and family therapist. I just got my permanent license. You can clap now. Thank you very much. Yes, and so I am legitimate. Okay, so the first thing I want to do is an exercise. I want you to trust me. Do you trust me?
Yes.
I have a face that says you can trust me, right?
Yeah, you do.
Don't shake your head. No. Okay, so you can trust me. Close your eyes. Close your eyes. Yes, close your eyes. Now breathe in through your nose. Breathe out through your mouth. Slow breaths. In through your nose, out through your mouth. Just relax. Now I want you to think about a memory associated with food, with eating. Think about a memory associated with food and eating. Think about where you are. Think about what you're eating. Think about who's there with you as you're eating. Think about what you're feeling if you're able to connect that. What are you feeling as you're eating with whomever you're eating it with? for some people, for most people, this is a positive exercise. And there are a few of you that it won't be positive, and I understand that. Okay? Now I want you to open your eyes. Now, I want someone to volunteer and tell me what you were eating, who you were eating it with, and where you were.
I was with my wife doing a date while my kids are at Awana's.
Yeah.
Hour and a half to ourselves.
Uh-huh.
And going to a Chinese buffet.
You were eating at the Chinese buffet with your wife, and what were you eating?
Everything.
Everything. Okay. And was that a positive experience for you?
It was positive because that was something that we could enjoy together.
Yeah, absolutely. Who else? Someone? Yes.
Lived in California for 3 years. My daughter and I had a favorite little sushi place that we would go to
Oh.
just whenever we were able to.
And you love sushi, and so that was a positive experience. Can you attach any specific emotions to that? What does that
Always
mean
in
to
good
you?
moods.
Always in a
Always
good
in good
mood.
moods.
Yeah.
We lived at the beach. Who couldn't be in a good
Oh,
mood?
you lived at the beach? Yeah, okay, I gotcha. And did you guys hear the gentleman in the back? You heard him talk about the Chinese? Yes, ma'am?
I was at a family event, a family that I don't see very often. So anyway, I felt out of place and anxious. And I discovered that not skinny popcorn, but Boom Chicka, some skinny, I don't know, some other popcorn that's out there that's in a big bag. Anyway, my sister had that on her table, and I caught myself, and she had nuts, but I was just kept, and it is really good. But, you know, I just ate a lot more, and that was me because I was being anxious and feeling that inside, but I didn't really register later until I talked to my husband. And his cue to me was to chew, right? To do your 40 chews. But that was his cue that he was watching me, and he was aware of the surroundings I was in, because it was just one side of my family. So,
And this is the memory that came to you when I
yeah,
asked you
because
to
it
do
just
that?
happened.
Oh, really?
Like in
Okay.
the last week. So it's
Okay.
it's a new memory.
So some memories, most of us will have positive memories, but sometimes we don't have positive memories. We have negative memories, particularly when it's attached to weight issues, shape, weight, those type of things. Ma'am, would you like to share with us what you were thinking about when you closed your eyes for me?
Oh,
When I forced you to?
I can't see, so I didn't know if I should close my eyes or not because
Oh.
I have no
That's
light
fine.
perception
Okay, well then-
anyway, so.
Okay, well, did you have a memory that you want
Yeah.
to share? Go
Yeah.
ahead. A memory of eating. What would be your,
I was with my family. It was Thanksgiving Day. All the kids were outside playing,
okay,
but I was never included because they didn't want to take the time to help me participate. So they ate. And I ate some more, and I ate some more, and I ate some more. And that was my family's way of keeping me happy was, okay, the kids won't play with you, so let's give you food.
very good. Thank you for sharing that. Is there one more person? Yes.
It was about 3 weeks ago when I was doing my 2 weeks before I had my surgery. And so I had, do the shakes and stuff, liquid. So I was with my family in Branson. And in Branson, it gets really, it's chock full of people, and you can't even go down that one lane road.
Girl, been there. Yes.
So-
Experienced it.
So they were passing restaurants and making changes to their, you know, we were like in 4 different cars, and so we're like calling and calling. I'm getting crazy. My blood sugar's bottoming out, and I'm licking like powder out of the bag.
Oh my gosh.
And I'm just starving, and we're just passing all these restaurants, and they want to go to Cracker Barrel at the end of the, you know, at the end of the strip. And we finally get there, and a big family feud happened. There's just like a whole bunch of things happening, and I broke down and I had some coleslaw because I was so starving, and they didn't have any soup. So that was my memory.
That was your memory. Okay, so for the rest of you, or each of you, turn to the person next to you, find somebody right next to you, and for those of you who did not share openly, share your memory of food from growing up. Just recently, share your memory. Talk amongst yourselves.
Our family always gathers around food. What even if you know, every family gets together is around food, right? And when I was small, my mom had a use of stepmother. She would console me with food. And so it's not too far stretched to understand. So now that's not training. So now I sometimes catch myself, but you know, you're limited in something physical. I was sick. I was so upset I can't go away from it. I was like, what's wrong with me? All I can say is I just need to cut the yard right now. Just like what? I need to cut the lawn. I need to mow the lawn right now. Because I was so
other outlet for
right, which was good because I had all that bottled up. Right. So you know, so instead of going to get a hamburger, fries, or doing something like that, I mowed that lawn and no time
Rechanneled it.
I rechanneled it. So that is, you know, or maybe it's
Let's take just one more minute to wrap it up.
Did you have surgery?
I did not.
No, I worked for them.
Well, I work for them.
Yeah, it's because I was like, my mom's like, your sister's no. I've never been to my family, even when I was a size. Because they're all training. So,
No, there's some fluctuation.
right.
I have my time with binge eating sweets and things like that. I am actually kind of cut out sweets a couple years ago.
Okay, thank you for participating in that exercise. We're going to come back together now. Don't you just love it when you get to talk to the person next to you? Did anybody hear really something really awesome that you want to share from that someone said to you, a memory that they shared with you? Did you hear anything that was like wow? No wow?
No wow.
No wow factor? Alrighty then, never mind. Okay. Okay, so what are you hearing as you're talking to one another? What did you hear as I asked that question earlier? What are you hearing about food and about feelings? What did you hear?
It's family.
Family. What else?
Comfort.
That food is a comfort. Sometimes we use food for comforting.
Right.
Okay? Denise?
yes, I do.
Yes, you do. Okay. Did you have something that you wanted to add?
What, about food and comfort?
Oh, I thought you raised your hand.
Oh, well, I can say that, so I am an emotional eater, and I just, because I go all day without eating, which that was my problem before. I mean, I did gain weight because I would eat late at night, but I am like a sugar-free bomb pop, sugar-free fruits, you know, and so those are my go-tos. But then the other day, by accident, I picked up one of the sugar that had sugar in it, the regulars, and it tasted awful to me. And I was just like, what is wrong with this? And it's because it was too sweet. Yep. So that was a really kind of an aha moment to me, because you know I don't think about it, and I am not that person that is textbook. I go, this is me, this is how I live my life. I'm in and out of the, you know, I don't walk a straight line. So sometimes if I want something, I'll have it, if my body will allow me to, but that was an aha moment to realize that is something that it was too sweet. So that was a
Yeah.
new experience for me.
So that means you're doing really good.
Palate, or what, did it have an effect on your body?
No, it was my palate. As soon as I tasted it, no, it didn't have an effect on my body, but it was just, and your body, my body tells me, maybe, it depends. It might tell me within 5 minutes, and there's symptoms like you, what is it? You burp, or you, like my eyes, my eyes will run, or my nose will run. Hiccup, oh, that's it. Yeah, you get hiccups, you know. Those are normal things.
And it's telling you stop?
It's telling you, yeah, that's your body saying, hello, don't do that, right? But you don't know those things are normal if you're starting out until we have group. That's why we have group.
Okay,
Right.
thank you very much, Denise, for sharing. Kristen?
I noticed like almost every memory was just emotional in general, whether positive or negative. They had pretty strong emotions, and nobody remembered like, you know, their regular lunch that they eat every day. It was like they were all like emotional memories.
Yes, yes, so very much emotions that are attached to food. We're going to talk just a little bit about that in just a second. Okay, so we're hearing about the people, it's about family, and it's about being with somebody that we care for, that we love. I heard about a spouse, I heard about the sister, and there's something about sharing that time together. And for you, it associates with, that's a form of comfort for you, okay? A form of, you feel safe, there's a security in that. I heard about Thanksgiving dinner, even though it became a negative. How many times is our eating surrounded by a holiday? You know, by just family coming together. It's about family and spending that time with other people. And sometimes that has become food. If you spend time with family, it's let's eat, right? And if you go to a Baptist church, or Presbyterian, or what? Or Methodist. Okay, the church experience does not help us with eating. Pentecostal, they're all, I'm telling you, it's about eating. Let's eat. Okay, so I want to do one more exercise now. Now that you know you can trust me, close your eyes. And if you don't need to close your eyes, that's okay. Okay. So now, I want you to get comfortable. Breathe in through your nose, out through your mouth. Get comfortable. A couple of more times. Relax your arms. If you have something in your hands, put them down. Lay your hands, palms up over your thighs or out. Somehow get yourself comfortable is the idea. Okay, now I want you to wrap your arms around yourself as much as possible. Give yourself a gentle hug. Hug yourself. Notice how that feels. If you can, rub your arms gently if it's okay with you. Give yourself a pat on the back. Stroke your hair. Now say comforting things to yourself. Pretend that you are your child, or pretend you are your grandchild. What would you say to that grandchild to comfort them? Say something's gone wrong today. What do you say to your children? What do you say to your grandchildren? Because often that's what we need to say to ourselves, and we don't. We say other things. What are you going to say to them? Okay? Now, open up your eyes. What was that like? Physically soothing yourself is what you just did. What did that feel like? Somebody talk to me. What did you experience?
It was nice.
It was nice? It felt nice?
Yeah.
Okay. Calming. Anything else?
Loving.
Loving. And what about when it came time to say those positive words to yourself? How was that experience for you? Was it easy for you? No, but it was for you. Was it difficult for others of you? No. For some of you, yes. So sometimes the way that we talk to ourselves is not positive. What we say to ourselves is negative. And so we need to replace that with positive words. Pretend, what do we say to ourselves when we eat what we shouldn't have eaten? When we do what we shouldn't have done? Are we kind to ourselves? Are we compassionate?
Say, let that be a lesson
But is that what you say to your children and your grandchildren?
Sometimes.
Depending on what it
Depends on
is.
what it is.
But if they did that, is that what you would say to them?
No.
Okay, all right. So sometimes we have to be more compassionate with ourselves, okay? So now, this is feeling. And for the most part, was there anyone who wants to share that says that was not comfortable for me? It was really tough for me. So different people are gonna have different experiences based on your past, based on what that is connected to for you. So we're talking about the connection between food and feelings. Okay, so basically I want to share just a couple of things about feelings and food. Okay, so the connection between the two is primitive and is powerful. So this goes all the way back to your infancy. As an infant, most of us were parented by people who were not everybody, but people who were relatively healthy. And so as an infant, how do you feed an infant? You cradle them, you touch them, you make sure that bottle is warm enough, you don't want it too cold, you don't want it too hot to burn them, you're making sure everything is just right. And you're looking at that cute little baby and you're just feeding that baby and you make sure you don't give the baby too much. All the care, all of that, those are feelings of nurturing that you receive. So those are our first attachments to food, to eating. Are those positive attachments? Those are bonds and they're positive. And so when we eat, those are our first attachments. And so those continue to grow because as we get a little bit older, if we have a bad day or if we're upset, what's mom give us to help us out? Ice cream?
French fries.
French fries. French fries. Your mother gave you French fries.
Take me to get French fries.
Oh, she took you to get French fries, cookies, candy. Okay, so do you see how we start to bond, to have these attachments with food? And sometimes they're not the healthiest attachments. Okay, so let me see what else I need to say here. So if you want to end disordered eating, that is eating in a way that is unhealthy, then you have to break that link between feelings and food. So now, how are we going to do that? I'm going to give you some statistics, and so they're a little bit boring. I am completing my doctorate in counseling, and so everything I write just looks like I'm submitting it to the research, to the board or something. So I gave my handouts to Chris a little bit ago, and she's like, no, I don't think we're going to give this to him. So we have to rewrite. So I have to redo them so that it'll be user-friendly or reader-friendly. Okay, so basically what I want to share with you, I'm going to talk a little bit about binge eating and loss of control eating. Now, Chris already explained to you that loss of control eating is what we term binge eating after you've had your bariatric surgery. Okay, and you'll understand why in just a second. So the APA has distinguished the characteristics of binge eating episode this way.
Who is APA?
That's the American Psychological Association.
Okay, just thank you.
Yeah. Okay, so, and you find this in the DSM, which is the manual that talks about all disorders. So eating disorders is just one section. And this is what psychologists, psychiatrists, therapists use to designate what a particular person is experiencing or to diagnose a particular disorder, okay? All right, so this is how they define binge eating episode. Regularly eating more food than most people would in a similar time under similar circumstances, marked by instances of compulsive overeating at least once per week for 3 months. Okay, so for those of you who've already had your surgery, let's go back to before you had your surgery, because as Chris said, right now you can't binge eat in that way because your body won't let you. Okay, so now what we call this after surgery, if you continue to eat more than you, those of you who've had your surgery, how many of you would say, I ate more than I should have? Okay, so you know what that feels like. Okay, so
It's
now the
awful.
difference is now you've had your, feels
Oh,
awful.
it feels awful after a while.
Yes, right. Okay, but so you know what it felt like before surgery, you know what it feels like now. So loss of control eating really is simply one of the sections under binge eating disorder. But we don't like to say binge eating disorder anymore, so we call it loss of control eating, okay? So loss of control eating. Now, so loss of control eating is defined as being compelled to eat or unable to resist or stop eating, resulting in initiating eating when it is not intended and or difficulty stopping eating. So, for example, you start eating and it's like, gosh, this is good, and you just can't
Popcorn.
stop. You just keep going. Does anybody know what I'm talking about? Okay. All right, loss of control. Chris is over there waving her hand. Okay, so loss of control eating. All right, so now I'm going to give you some research stuff now. Okay, so BED, or binge eating disorder, after surgery we call it what?
Loss of control.
Loss of control eating. That is the most common disorder among United States adults. And it is more equal in gender ratio than all the other eating disorders. So if I talk to you about eating disorders, which ones would you be able to tell me about? What are the common ones? Anorexia, bulimia.
Binge, yeah.
Binge eating is one of the characteristics actually under bulimia, but it is a separate disorder all to itself in the APA DSM. Okay, so BED is the most common eating disorder, even though we hear less about it. And 28 million men and women of all sizes, so whether you're underweight or overweight, whether that person has had surgery or hasn't had surgery, it affects everybody in all shapes and weights. So it's prevalent in the United States across racial and ethnic groups, including non-Latino white, Latino, Asian, African American. Has a lifetime prevalence estimate of 2.8% of adults across the country, and is associated strongly with obesity, elevated psychiatric and medical comorbidity, and psychosocial impairment. So basically what I'm saying is we know that at least 30%, and we can see all the way up to 60% of folks who come in to a clinic to seek bariatric surgery, 30 to 60% statistically are affected with BED. Okay, so are experiencing BED. All right. And so generally speaking, BED usually is only diagnosed in the bariatric populations because they're seeking to get bariatric surgery, not because they're trying to fix the BED, because most people don't even recognize that it really is a disorder. Okay, so now let's see here. Bariatric surgery and BED. Bariatric surgery is recognized as the most effective, the most cost-efficient treatment for severe obesity. Across the board, it's recognized. Now, unfortunately, weight loss surgery does not have it doesn't have equal results in every patient. There's some patients who have the surgery and they're able to lose the weight and they're real thrilled with the amount of weight that they've lost. And they don't regain the weight. And then there's some patients who have the surgery, they're unable to lose the weight. Or if they lost it, they regain it. Okay? All right, so we know that there's a subpopulation of bariatric patients. So what I'm saying is that this is not every bariatric patient does not have BED. Okay, I'm not telling you that. There is a percentage. Oh, yes, ma'am?
I was just going to comment on, you said some people gain back, and I read some of the people that say that they did and they're trying to go, lose it again, and that frightens me when I hear that, because I'm thinking, okay, I'm doing good, but I've got to be ever vigilant, It's frightening.
Yeah, I'm glad that Chris is here because she can, help, address some of these things. But there are different, what we know through statistics is that primarily, or by and large, the reasons, okay, so eating disorders like binge eating, if a person has binge eating, it's a psychological problem. okay? It's cognitive in nature. It's fueled by guilt, shame, low self-esteem, and is prevalent among obese patients, okay? So it's a psychological issue. So when we have the weight loss surgery, if we don't deal with what? The psychological issue, then you haven't dealt with what is fueling your problem. Okay, and so like I said, not every patient who has bariatric surgery has BED. Those people are able to have the surgery, lose the weight, keep the weight off, go on with their life. And some people who with BED are successful, but generally speaking, those are the ones who are dealing with the psychological piece of it, okay? So if you're struggling with the weight loss, if you haven't had your surgery yet, or if you've had surgery and you're doing fine, then don't worry about it. You're doing fine. Continue to come to support groups. Statistically, what I see in research is the folks who've had bariatric surgery who are the most successful are people who, number one, they follow the plan. They do what the clinic said to do first. And then secondly, there are people who get the psychiatric help that they need, they get the supports that they need, and they come to support group. That's what research says, okay? So do the things that you're supposed to do, and then trust the system that it's going to work. And if you find that you're struggling and it's not working, then start looking at the pieces, you know? And before you leave here, I'll give you a BED screener to see, and you'll be able to see if you're screening positively for BED. As far as being diagnosed for it, what I recommend that you do from there, if you see, I'll be able to tell you today if you're screening positive. And then from there, you would take that to Dr. Sarati. Do you know who Dr. Sarati is? Yeah, take that to Dr. Sarati and he'll know what to do with that. And then, so he handles the medical piece, and then you need someone to do the cognitive piece, psychological piece. And I happen to know a therapist who just got her permanent license. Just saying. Okay, so, all right, so now bariatric surgery does not cure the psychological aspects of overeating, okay, or binge eating linked to extreme obesity and issues such as depression, which we know that folks who come for bariatric surgery have a higher rate, and particularly those with BED have a much higher rate of depression, anxiety, lack of control, impulsivity, and difficulty coping with stress. And that's what the psychological piece can help you with, okay? All right, now cognitive behavioral therapy, let me see where I am on time. Okay, so CBT, cognitive behavioral therapy, is anybody familiar with that terminology? Okay, so basically the gist of it is the things that you think, negative or positive, create feelings. Those feelings cause you to act out behaviors, okay? So sometimes because of your negative thoughts, it causes you to feel bad. And because you feel bad, you do what you didn't want to do, which is eat the whole box of Cheez-Its. You see what I'm saying? Okay, so that's what cognitive behavioral therapy can help you with. Okay, so let me see. Oh, I want to share this statistic. In a sample of nearly 300 obese individuals qualifying for gastric bypass surgery, 60% had a lifetime history of an eating disorder. Had a lifetime history. And we know even with BED that it starts very young. And some of the research that I saw shows that it starts as young as age 11, age 13, age 15. Okay, so, but because we don't identify it and we don't talk very much about it, even our children, you know, can be suffering with this. 48% met the diagnostic criteria for BED at the time of their preoperative evaluation for bariatric surgery. And of the 48% diagnosed with BED, 28.8% developed bulimia nervosa, bulimia after surgery, post-surgery. And so especially people who are not, especially those people who've had bariatric surgery who are not following the nutritional guidelines, it can lead to an eating disorder called bulimia. So you want to be very careful that you do those things that you're supposed to do. But as this says, 28.8% is the statistic. That's the rate. Okay. Research determines that patients who engage in episodes of binge eating after bariatric surgery are more likely to exhibit weight gain than people who do not engage in binge eating. Cognitive behavioral therapy is the leading evidence-based treatment for adults with an eating disorder across the board, undeniably. CBT is the leading evidence-based treatment for adults with eating disorder. Data indicates that about 2/3 of people who complete CBE respond successfully. 2/3 of the people who get that help, get the cognitive treatment for BED, are successful. Last thing is studies prove patients with pre-surgery BED, termed loss of control eating post-surgery, experience more psychological distress than bariatric patients without the disorder, and indicate that these patients are at higher risk for developing post-surgery complications and continued or new diagnosis of eating disorders if they're unable to stop binge eating. Does that make sense? Yeah. So if you're not able to stop binge eating, or if you're not able to stop, and there are also a couple of other syndromes, or for instance, BED, not until 2013 did it even have its own distinct disorder. So for example, if you looked in the DSM-5 or 4, and all you would have seen is anorexia and bulimia. Those were the only two that were out there, and everything else was called other, okay? Other specified. Okay, so now you'll see that BED is out there as a distinct eating disorder unto itself. Now there's a couple other disorders that are associated with obesity. Those are, one, night eating. Does anybody know what I'm talking about? It's nighttime, and all of a sudden you're up and you're downstairs in the refrigerator door looking. Yeah. Anybody experiencing that? Okay. And then also grazing, where you're not eating, you're not binging, you're not eating all of this, but you just don't stop. You're picking at this. You just keep picking, you keep picking, you keep picking. Does anybody know what I'm talking about? Okay, so those are two that they don't have their own distinct disorder at this time. They're called syndromes, and what happened, BED was there until it moved into its own. So they'll eventually catch up and give them their own, but we know that those two in particular are very much associated with folks with obesity and those folks who are coming out of bariatric surgery. So if you're experiencing those things, then the reason we share this is not to scare you, but so that you will move forward and get help. Okay, get help with it. And so your first point of contact is going to be this office here with Chris. Yes, ma'am.
You were saying how people it wasn't even considered a season. Years ago, I am a compulsive overeater. I am, well, what you call it now, the OB.
The BED.
Yeah. Mm-hmm. And my husband had to go into treatment for drug abuse, and was in treatment, and I went to the meeting, and I started noticing that everything I was hearing about the things that drive them and so forth was so familiar. Mm-hmm. And I went and talked to one of the counselors, and I said, I wish there was a place. So that's the way I feel about my eating. And he said, well, and he kind of directed me into, there was, it's just nobody knew about it. There was a place for me, and it helped me immensely.
Oh, good. Good.
I didn't stick with it, which didn't help me, but yeah, it was.
But the good news is you can always go back.
Yeah,
but you can always go back. Exactly. And remember that if you do it wrong, don't stop. Don't just, if you fall, don't just lay down and stay there. When your children, how many of you have children? Okay, when they were young, let's say they were, when do they start walking? About 7 months to
2 years.
Oh, 2 years. Oh, you're okay. Whatever. Okay. 13 months. Okay. Well, so mine was just really smart. No, I don't know. Okay, so when your children first started walking, did they just stand up and start walking? What'd they do?
Stumbled a little bit.
They stumbled, they fell, they sat down, they fell over, they did all kind of stuff. They wobbled, but then they finally got up and started walking. So now, just like that child, when your children didn't do it the first time, did you say, oh, you dumb kid, you're never going to walk? Is that what you did? No, what did you say? Come on, baby, you can do it, get up, do it again, you got to do it again. Because you know that there is success. And so that's what you've got to say to yourself. Those are the comforting words that you have to tell yourself. Just because you did it wrong today, or just because you did it wrong, even if you're looking to see what you ate today and you didn't get your protein in for breakfast, or you didn't get it in for lunch, or you did it wrong, or you added something you shouldn't have added, don't beat yourself up. Look at breakfast, and if you know you didn't do breakfast right, just say, well, I didn't do so hot with breakfast. Well, what we have the habit of doing is, I just messed the whole day up, and then what do? We just say, forget it, I'll just eat everything now. No, just look at it in the segments. I didn't do well for breakfast, but here, I did pretty good for lunch. I did fine for dinner, but if you beat yourself up for breakfast, then you'll ruin the whole rest of the day. Okay, so be gentle with yourself. Okay, so now that is pretty much what I have for you. And now if you have questions, anybody got questions? Oh, I must have done fabulous.
I have a comment.
Comment?
So, or not a comment.
It's okay.
To add to this, there's a new movie on Netflix, and it's about a girl that has bulimia, and it was really interesting. And I hate to blow it for people, but at the end, the mother says, you know, she says, I'd like to just hold you because when I was when you were growing up, I had like depression.
Oh, postpartum depression?
She had postpartum depression.
After she'd had the baby, she had postpartum?
So the girl, you know, is bulimic, and so she says, you know, I think my friend told me, as a life coach, to cradle you and feed you. So she did it, and then afterwards the girl didn't want to do it, but she finally did it, and then she made decisions to get better afterwards.
Wonderful. That kind of ties together with some of the things we've been talking about. And I did want to just piggyback, say a little bit about what you were sharing about there are some addictive features associated with eating. So when we say eating disorders, there's some features that are addictive, but as far as BED, the research that I'm seeing, they will not say it is like addiction. There are some addictive pieces, you know, things that remind you of an addiction, especially when you're experiencing that true loss of control eating, where it's like, I literally cannot stop. You know, those are those feelings of addiction.
So, Kathi and I go way back because before I had surgery, and I had to wait 6 months, she was looking for people to help her complete her doctorate. And so, yes, that was, I'm one of those people. But so I strongly recommend on any level that Kathi has changed my life. But one of the things that she helped me do is to realize my triggers. And you know, we all have triggers, but I didn't really look at it that way. So it's just that by sharing with Kathi that she was able to identify those things. And then all of a sudden when it happened, you're like, oh, it's a trigger. Yeah. So then it's to be able to have the tools to make that choice what to do with it. Yeah. Okay? I sometimes rechannel my energy by, one day I came home and I was upset. You could tell I was upset. And all I could say to my husband is, please just let me cut the grass. And he's like, but what's wrong? I'm like, get the lawnmower out. I need to cut the grass. Okay? So you know what? I cut the grass, and after that, I was fine. But I just had all that energy that I just needed to do something with. And so I learned to channel that way. And now at least I know, and he knows too, to get the lawnmower out or whatever. You know? But I just, so Kathi, she's helped my marriage. She's helped me personally. You know, for me, she's like an angel on earth. So I highly recommend you.
Oh, thank you so much, Denise. And I will put that check in the mail to you.
Okay.
Thanks, girl. Okay, so
discount on the next appointment.
That's right. Free one. And so, and sometimes the psychological distress that you're going through, it may have to do with home. Many times, most times, okay? And so it's not always you, and it's not always your past, but then sometimes there's other issues. There's stuff from your past that's got you where you are. And so that's what getting that psychological piece will do for you. It'll help you to deal with those things, because if you don't get them dealt with, then they're not going to go away.
And that's why we're here, to get healthier. That's
That's
why
right.
we're having the surgery,
Absolutely.
right? So it's just part, for me, it's just part of
Healthier
it.
physically, healthier
mentally.
emotionally.
Yeah, that's
And-
why we're
and
all
if you
here.
can get it taken care of, then your life truly can be happy, because isn't that what we all want?
Yep.
All right, so to your happiness, all right? Thank you. You guys have been awesome.